formulation versus Relenza, which is more of the inhalation formulation. And Tamiflu is a prodrug, and it requires hepatic hydrolysis to become the active formulation or active metabolite, which is the oseltamivir carboxylate. Has anyone seen the case report about the drug interaction between Tamiflu and Plavix? Okay. Well, there's a case report that's current, and it's for those patients that you know who are on Plavix because of a stent or a previous MI and needing to be on Tamiflu. Plavix has been found to inhibit the hydrolysis of Tamiflu, thereby reducing the activity of Tamiflu by 90%. So those who are receiving Tamiflu in the hospital or in the clinic and are on Plavix is something that you may have to switch them to another agent. I would recommend switching them out from Plavix to something else, just to maintain them on Tamiflu for about 10 days for prophylaxis. So that's a current drug-drug interaction to know. For those who are suspected to have symptoms of H1N1 infection, it is recommended for children younger than 2 years old, persons aged 65 years and older, taking care of these children. So if they're healthy people, 65 years and older, and not taking care of the children who are sick, then we don't really recommend empiric treatment for those people. Pregnant women, of course, persons of any age with certain chronic medical or immunosuppressive conditions, again, diabetes, asthma, autoimmune diseases, persons younger than 19 years of age who are receiving long-term aspirin therapy, who are at risk for Reye syndrome. And you probably have seen this in your pharmacy of what Tamiflu looks like. It comes in a capsule formulation as well as the oral suspension formulation for pediatrics. The prophylactic recommended dose is 75 milligrams once a day for 10 days versus treatment, which is 75 milligrams twice a day for 5 days and as soon as possible. So you don't really wait for 48 hours of symptoms. Once they present, just go ahead and administer it. I've seen 150 milligrams twice a day now in the hospital too, being used as treatment. So we're getting aggressive there. Originally, Tamiflu is not indicated for children less than 1 year old. But now, because of the H1N1, they're using it for those less than 1 year old, even those 3 to 5 months prophylactically and for treatment. And with a lot of pediatric medications, they're all weight-based. So you can read this on your own. Okay, the common side effect profile associated with Tamiflu are, again, nausea, vomiting, abdominal pain, some headaches, some nosebleeds. Of course, they resolve over time. And then Relenza is the other counterpart. And again, the prophylactic duration is for 10 days. Treatment duration is for 5 days. It is dosed Q24 prophylactically. And for treatment, it is dosed every 12 hours. And it is recommended to be, for 2 doses to be given on day 1 at least 2 hours apart. That's how it should be administered. And the good thing about Relenza is that there are no adjustments necessary for those with renal or hepatic impairment, mild hepatic impairment. If they have severe hepatic impairment, then dose adjustments are recommended. And you can see that on the prescriber insert. Okay. Relenza, again, is inhaled. The one thing that I want to reemphasize is that the reason why it doesn't gain momentum as compared to Tamiflu is because of risk for bronchospasm and other severe respiratory side effects associated with it. Okay. Common ADR profile, again, nausea, dizziness, some bronchitis, cough, malaise, myalgia, appetite changes. Okay, so this is what you were referring to about this Dear Healthcare Provider letter, that apparently some of the facilities were using Relenza and using it as a nebulizing solution. And they found one case report of a death, and basically GSK, the producer of Relenza, sent out this Dear Healthcare Provider letter with the FDA saying that Relenza has never been approved to be used as a nebulizer or as a nebulizing agent. And the cause of death is hypothesized to be due to a lactose drug carrier that can actually obstruct the proper functioning of the mechanical ventilator equipment. Of course, this patient wasn't getting respiratory support. Yeah. So it blocked the passageway of the respiratory machine. Okay, moving along, peramivir is the third neuraminidase inhibitor, and it is under investigational use right now. It is in phase 3 trials, and it is the only agent in IV formulation other than Relenza, which is currently used in Europe, but according to one of our colleagues here, he had mentioned that the CDC does have it. Currently, it is under development for treatment of acute influenza in patients who require hospitalization due to the severity of the infection. And because it is in phase 3, data is still being collected, and the efficacy and safety of peramivir has not been established. And of course, it is used to treat certain adult and pediatric patients with suspected or laboratory confirmed H1N1 virus infection.